started. Hello, my name is Mohammed. Today, I'll be going over 5 drugs from 5 different classifications. In this video, I'll be going over the drug's actions, indications, side effects that are associated with each drug, lab values to watch out for, patient education that must be done, as well as nursing assessments prior, during, and after each medication. The first medication we have here is hydrochlorothiazide. Hydrochlorothiazide is an anti-hypertensive agent. It helps the body from absorbing too much salt, which can lead to fluid overload. It is used to treat hypertension, which is high blood pressure, as well as edemas associated with heart failure, cirrhosis, and renal dysfunction. The most frequent side effects of hydrochlorothiazide include, but are not limited to, nausea and vomiting, anorexia, and hypoglycemia. Labs to monitor when administering this medication are sodium potassium levels, glucose, and BUN levels. Patient education that should be done with hydrochlorothiazide are instructing the patient to take this medication the same time every day, as well as instructing the patient to report any signs or symptoms of cramping, muscle weakness, nausea and vomiting to their healthcare provider. Nursing assessments that should be done prior to this medication administration includes checking for allergies, obtaining a baseline for vital signs such as heart rate, blood pressure, respirations, and temperature. And as well, always checking labs to see, just to have a baseline. While monitoring, during this medication administration, you should monitor blood pressure and INOs. The second medication we have here is vancomycin. Vancomycin is an antibiotic medication. It produces bacteriocytic effects by inhibiting cell wall synthesis and alters cell membrane permeability in RNA synthesis. What does that mean? It interrupts the bacteria from entering the cell wall. Vancomycin is used to treat many infections, including pneumonia, which is fluid in the lungs, septicemia, meningitis, and many others. Vancomycin is also used to treat serious infections in people that are allergic to penicillin. Most frequent side effects of vancomycin include, but are not limited to, anaphylaxis, fever, as well as back and neck pain. Labs to monitor for this drug are albumin, CBC, specific gravity, and may cause an increase in BUN levels. Patient education that should be done for vancomycin is instructing the patient to report any signs of vertigo and hearing loss, as well as making sure they notify their healthcare provider if pregnancy is planned, suspected, or if breastfeeding. Nursing assessments that should be done prior to the administration of vancomycin is, again, checking allergies, obtaining a baseline for vital signs, stool, white blood counts, wound. And during mid-administration, you should just monitor blood pressure, IV sites, and INOs. And after mid-administration, just recheck vital signs and labs. Because vancomycin irritates the skin, so making sure the IV site is not inflamed is very important. The third drug that we have here is Enoxaparin. Enoxaparin is an anticoagulant medication. It interrupts the intrinsic pathway and prevents the blood from clotting. It is used to prevent and treat DVTs, which are deep vein thrombosis, types of anginas, and MIs. Most frequent side effects of enoxaparin include, but are not limited to, headache, bleeding, and dizziness. Labs to watch out for when administering this medication or when giving any anticoagulant medication include CBC, platelets, H&H, due to the bleeding and anemia. The first patient education that should be done when giving Enoxaparin is to have the patient notify their healthcare provider if they notice uncontrollable bleeding anywhere. Nursing assessments that should be done prior to giving Enoxaparin is, again, checking allergies, obtaining a baseline of vital signs, getting labs, checking CBC, platelets, white blood counts are within normal ranges. And the fourth drug that we have here is Lorazepam. Lorazepam is a benzodiazepine medication. It affects chemicals in the brain that may be unbalanced in people with certain conditions, people with anxiety disorders, and it may also be used as a pre-anesthetic drug to produce sedation during surgeries. Most frequent side effects for Lorazepam include, but are not limited to, apnea, lethargic, and drowsiness. Patient education that should be done for Lorazepam include instructing the patient to avoid driving or any other activities that require alertness. Avoid alcohol or any other CNS depressants. Nursing assessments that should be done prior to Lorazepam administration include checking if the patient is allergic to this medication, just getting a baseline of vital signs, and obtaining lab values is very important. And then after administration, just check those things again. The fifth drug and the very last drug we have here is Carvedilol. Carvedilol affects the heart and circulation, blood flow through the arteries and veins, decreasing heart rate and blood pressure. It is used to treat heart failure and hypertension. It is also used to treat a heart attack that has caused the heart to not pump as well. The most frequent side effects for Carvedilol include, but are not limited to, are pulmonary edema, bradycardia, and weakness. The labs monitor for Carvedilol include an increase in BUN, potassium levels, and as well as an increase in blood glucose levels. A patient education that should be done for Carvedilol is holding the medication or contacting a healthcare professional if the heart rate is less than 50 beats per minute. This drug may cause drowsiness and dizziness. Therefore, avoid any driving or any activities that require alertness. Nursing assessments that should be done prior, during, and after the administration of Carvedilol include obtaining a baseline of vital signs, checking allergies, checking labs, monitoring eye and nose, blood pressure, and then at the very end, after the administration, just rechecking vital signs and lab values to make sure they are within normal ranges.
markaan ku helaa nasto karaystani taaqade muunahay nolosheedii nafteedii inuuda habeerkiyo jirka dhashii nabi yuusufe markaan ku helaa helaan nasto karaystani taaqade niyadiya qalbigii bukaade adigu soo noolaysayo laha waxa dumar facaya nabadinani